when it comes to reporting. First of all, you are being told to pay for the P3 forms, which is 1,500. Maybe as a victim you don't have. And also the case is taking longer. Every time you go to the police, before the victim is arrested, they're told, first of all, you have to wait. And so people feel like they're being neglected. And they prefer just to shut up with their cases. As you can see today, a lot of people here, victims, they're really having heavy hearts. Even someone cannot speak because it's really affecting them. And you know, once you speak out and you continue speaking out, it's the time that you get healed. So I really encourage, even in Murang'a County, we can get a safe space. And also counseling. We need to get counselors who will really listen to our voices, understand us. Not like, here we get counselors, they need to charge us, they're not ready, others are ignorant. So we need people who will fight for us, understand us. Being a victim, it's not a choice.
Between 2016 to date, we have lost almost 700 women to GBV, to femicide. We are losing about 40 women per month to femicide. That is a very, very alarming figure. It is a very shocking figure, and that is why this action has been taken by the head of state so that we address it. What we have had is kangaroo courts are a problem. What we have had is culture is a problem, and that culture, part of it is this payment of dowry. We have heard from parts of this country that something which used to be noble, exchange of dowry used to be a noble thing, just to cement families, but now it has been commercialized, and for some it is becoming problematic. It causes friction in the new families. So those are things we are going to look at, and I can assure Kenyans that the recommendations we are going to make will reflect the reality.
I'm the coordinator of gender-based violence prevention and response in Murang'a County. And as regards GBV, in 2022, Murang'a was revealed as the second county in terms of violation of gender-based violence. After Bugoma, we were at 24% in sexual gender-based violence, and for physical violence, we were very high. So that called upon the county leadership to call a multi-sectoral group meeting that was to discuss on the way forward in ways of how to handle and prevent GBV issues in future. So number one, we started with a survey in 2023 to confirm that actually that was true or it was false. And after the survey, we actually confirmed that all forms of gender-based violence exist in Murang'a, all of them that had been mentioned. And therefore, in that forum of multi-sectoral representation, we sat down and drew a county GBV action plan that we are currently now implementing. So far, we've been able to sensitize CHPs, 500 of them, and community health assistants. We've also been able to sensitize multi-sectoral persons from all the sub-counties, and we've actually formed gender technical working groups for all the sub-counties. Initially, we only had one for the county that is chaired by the county commissioner, but we didn't have any other technical working group for the sub-counties. So as I talk, in the last 2 months, we've been able to accomplish that, and all sub-counties can now discuss issues GBV coming up in their own sub-counties. We actually appreciate that this task force was formed because to look for at the matters cutting across the county. Now, particularly for Murang'a, we have issues of rescue centers, especially touching on the intimate partner violence. When we have them come to our own facilities, at the health facilities, we don't know where to take them after we are discharging them. And we don't want them to go back to the same environment they came from. So that one has been a great challenge. So therefore, I would request that in whatever manner possible, the head of state, our president, forms at least one rescue center for every county so that we are able to deal with these matters In those counties, those rescue centers, the county should be able to provide the psychosocial support, counselors within the facilities, and also medical health workers, so that there are other issues are also addressed in terms of illnesses and injuries. Yes, that is one of the requests I would want to make. Then we also have a policy to exclude sexual gender-based violence in payments in the health facilities. But then we do not have such a similar law or policy that is recommending other forms of gender-based violence, other injuries arising from gender-based violence to be free. Therefore, in that one, we are getting a challenge. I would recommend that we have one national law that is prohibiting any person or any hospital to charge. Now what happens is that we must go through the process of waiving, which is sometimes is tedious because hospitals do not want to lose income.